Hi, my name is Rachel McFarland, and today I am going to instruct you how to take a manual blood pressure. And first off, we're going to start out with learning about the blood pressure cuff. You're going to want to find a blood pressure cuff or buy one from the store that has a gauge included with it, and you're going to need your rubber bulb and then your open and close valve. And sometimes the blood pressure cuffs do not include those in it, so you're going to make sure that you have that. And then you're also going to need your stethoscope. And then we're going to go over some important things that you need to remember before taking a blood pressure. You need to make sure that you have the correct size blood pressure cuffs, because there's an adult regular, large, and extra large. There's also a child size blood pressure cuff if you're doing it on a child. And then you're going to talk to the patient and find out if they have an arm preference, and that includes if they've had a mastectomy or blood clot, PICC line. If you're in a hospital setting, it might be an IV. If they've had any of those things in the arm, you're going to want to use the other arm. And then when you go and you take the patient back, you're going to want to wait 3 to 5 minutes before taking their blood pressure, and that gives you time to take their vitals, get their chief complaint, and then you're going to go ahead and take their blood pressure. You're also going to want to ask them if they've eaten recently, exercised, or smoked, and if they have, you're going to wait 30 minutes before taking their blood pressure. You're also going to, when you have them take a seat, you can look at Karen here, and you're going to ask them to take a seat in a chair that has a back, and then ask them to uncross their legs and have their feet flat on the floor. And then when you take their blood pressure, you're going to lift their sleeve up and make sure that you're taking it on bare skin. Now, you also want to find their brachial pulse, and that's going to be towards the distal part of their body. You're going to have them extend their arm, and then you're going to find their brachial pulse, and that's where you're going to put your stethoscope to check for their blood pressure. And you're going to first start out by listening for the systolic beat. So you're going to start out and you're going to pump up the blood pressure cuff, and you're going to pump it up to usually 180 if they have a history of blood pressure, because you're going to ask them before you actually take the blood pressure what their normal blood pressure is. If they do know, say hers is 140 over 70 or 80, then you're going to pump it up to probably 180 to 190. And then you're going to slowly deflate it at 2 millimeters of mercury per minute, and then you're going to open your valve, and you're going to slowly deflate that, and you're going to finally start hearing the systolic beat, and it's going to be like boom, 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 boom. And then when you first hear that beat, that's going to be your systolic beat, and then when you finally stop hearing that beat, that is going to be your diastolic beat, and that's going to be your bottom number. So if you start hearing it at 76, that's going to be your bottom number. So now we're going to take her blood pressure, and I'm going to first find her pulse here. All right. And you're going to make sure that this index marker right here is right on her pulse. And then you're going to put your stethoscope in your ears. And you're going to make sure that the patient's not talking. You want it to be quiet. And you're also not going to want to be talking to the patient either. And then you're going to pump it up slowly to 180. And then you're going to slowly release the valve. Alright, and Karen's blood pressure is 110 over 68. Alright, and that is how you take your blood pressure. Thank you.